Hi guys, welcome back to my channel. So today, in this video, I'm gonna show you guys like what's inside our nursing clinical bag. So this bag, again, in my school, Jacksonville University, they gave us this one for, for if you're a brand new student. So again, it's been a while. I'm already on my second semester, so some of the stuff that originally was inside, we already used it, and I added more stuff that I needed like for my clinicals. So the first thing that any student should have is like notepad, right? So I have this one. I like this one because I ordered this one from Amazon, I think, because this one is made out of like recycled material. So when I saw like it's reused, recycled stuff, so I kind of like purchased this one. It's also like waterproof, so whenever you write something, especially if you're working with during a like near wet areas, or if there's spilled coffee, whatever. So if it's spilled, it's not really gonna degrade the writing that you're gonna use on your notepad. So yeah, so I have this one, and also I use this one multicolored pen. Again, so that whenever you're writing something on your pad, just write it up, and then if you want to switch colors so that it would be easier to like memorize, then you can use it. So red would be like, example would be like out of range, like lab values, and then other colors would be just like highlight, so that it's easier for you to actually like distinguish some notes, especially if you're doing like pass down or like from a different nurse or different professionals, so you can actually remember what's going on with the patient. All right, so let's start opening the bag. So I feel like this is like a mystery box. Again, like every nursing student has their own stuff inside. So this one, again, it depends on your area. So this is a lab coat that we have. Again, the common lab coat would be like what color white, but this one is like we're required to actually like use like what they call it, same color as our scrub. So we were wearing like hunter green scrubs. So I have this one in case it's really cold in the morning, especially like clinical starts like way early, like around 6 a.m. So you have to be there by 5 to actually prep for it. So this one, I have the Davis drug book. So again, if you're doing clinicals, also if you're doing your care plan, you actually need to like know some medications that you're giving to the patient. So example like this, cyclobenzaprine over here, and it would tell you like what are the classification, action, the dosage, and then what's the implication for you, and then intervention as a nurse, and then what's basically the outcome that you want to achieve whenever you're giving medication, is to make the patient feel better or manage their sickness. Again, this one, I bought this stethoscope. Again, every nurse, because for assessing their patient, they need to have a stethoscope. Again, also when you're doing like lung sounds or hearing for the heart, so you're gonna use again, there's two sides over here, the diaphragm side and the bell side of the stethoscope. This one is for like the regular sounds, and then for low pitch sounds, you're gonna use the bell side like to like hear like bruits and stuff. Again, when you're wearing this one, you want to wear like over your ear like this, so that you can hear the sound, not away from your ear canal. Yep. And also you have to clean it all the time, because again, if you're using it to like one patient to another, it's gonna transmit the infection to the other ones. This one, earplugs. I bought this one before like the first semester of school, because people were saying like during the exam you get distracted, so you can wear some earplugs to actually like avoid from hearing distractions like inside the room. So I bought this one just in case. I didn't really need it, but I have it just in case I need it. All right, so the next one would be, this one is a freebie for us. So they gave us this one. Is a blood pressure tool or equipment. So again, this is the manual blood pressure, right? So most of the hospitals now or clinics or whatever, they use the automatic one. You can just press the button and then kind of like inflate the blood pressure cuff. But in nursing school, again, you know, you actually need to learn how to use this one, the manual blood pressure. So again, over here, you can actually like, no, you can see like where to put the blood pressure cuff, as a left arm or right arm, and then make sure it's aligned to the patient. And then again, make sure it's not really too tight, because you don't want to like cut off the circulation. And then once you already put the armband over here, you close the valve all the way. Make sure you bleed it out first. And then you can pump, and it's gonna inflate. And then, you know, slowly open it and hear the sound. And then once you hear the systolic, diastolic, then open it all the way and all of that. And then again, they teach us that one during nursing school, so it's awesome. And I think most of the nursing school requires that as part of their checkups. All right, so after the blood pressure cuff, there's some stuff here that some of you might not even want to see, but these are the things that, you know, you need like or use in nursing. So starter kit, IV starter kit, they have that. Secondary set. Catheter over here. So again, you have to like know how to insert catheters also. And then because like some patients require like monitored intake and output, so you actually need to like be able to drain the sample and then record the how many mLs of output is it gonna be, you know. All right, and then other stuff also, swabs. Yeah, most of the things over here are just gauges. Gauge, and this one is the pen light. Yeah, I'm not gonna like talk about the other ones because most of them are saline and other stuff. So this is like the next important thing. Also, you need to have a pen light, because again, we use this one to like usually check for a lot of stuff like inside the nose, eyes, right? The perla, pupils equal round and reactive to light and accommodation. So you can see, you know, like you can look at the patient's eye if they're like dilating or constricting, and if they're following the motion, right? So you can see if there's like cranial nerve that is being damaged or not. So this one, it's cool because like you can see over here on the pen light, pupil gauge. So from the constricted pupil to the most dilated one. So again, if you see like someone like, you know, having constricted eyes, like it might be an indication of addiction, drug addiction, so on and so forth. And if they're dilated, of course, like they might have like severe blood loss, or they're about to die, and you know, it's kind of scary, but you have to know those symptoms. And over here again, you can see there's a lot of like fluids over here that we use for practice. That's why I put it on the Ziploc bag, so that, you know, in case it would spill, it's not really gonna like wet all the inside of the bag. Because last time, like, I didn't really put anything in this one. I was just like, oh, I'm just gonna probably like close it, and then next thing you know, after I got back to my house, like, you know, it spilled. So because like the cap went off. So it's better to be safe than sorry. Make sure you have your Ziploc bag, also like secure your IVs. And yeah, so far nursing school is good. Again, you know, some people like to be fancy and they buy their own like designed nursing bag. But yeah, so this is it, guys. So this is my this is the bag that I use for nursing school. Again, thank you for watching. All right, have a nice day.